Hi, everybody. I wanted to talk to you. This is really for dentists only. If you're a patient or potential patient, you can listen because it may be interesting. But just got this back, and I thought it was an important step in the implant dentistry process. Um, we've been doing this for a lot of years, since actually 1982, give or take. And there have been lots of advances in implant dentistry, and the success rates are very high. And it's probably one of the best services we can supply to any patient at any time. Um, in most cases, it can avoid either full or partial edentalism and allows us to really restore people to a almost normal state of health where they can function as if they had all their teeth back. So implant dentistry is great. There are certain issues. Implants do not move. So natural teeth do. So when you're working with implants, it's absolutely critical that everything be 100% accurate. There's really no room for error. So one of the steps in the process, and once again, this gets down into the weeds, but it's more for dentists. One of the steps in the process is something I call, or maybe it's not my term, it's been around for a long time, is a verification index. Now, what does this mean? Well, when we take an impression, especially on multiple implants, when you're restoring an entire jaw or something of that nature, where there could be 5, 6, 7, 8 implants, whatever the number happens to be. And as a prosthodontist, I work with multiple oral surgeons, periodontists, general dentists to help restore dental implants. So there are times that I will get the case after the implants are already placed. So I don't have a lot of control as to where they may be. Or in cases where we actually do the diagnosis and treatment planning, that we may not have the options that we'd like. Sometimes the bone just doesn't cooperate. So it's very important that the models be very accurate. Well, how do you do that? Well, most dentists today know how to take an impression for implants. And for those of you that are not dentists or that are just starting out, what we basically do is place something called an implant transfer. It's a little device that you screw into the implant, and they're either closed tray or open tray, and that's not so critical for the purpose of this 5-6 minute presentation. But you're going to eventually get a model. Now the problem is, how do you know if that model is accurate? Now there are distortions when models are poured, there are distortions in impression materials. When you screw the implants into the transfers, implant body transfers, into the actual implant, was it accurate? Did you take x-rays afterwards to make sure it was truly seated? Was the x-ray accurate? Did you read it properly? Well, it's very important that the model be accurate. Once you know you have an accurate model, then you can go ahead and actually plan your restoration with somewhat confidence that everything at the future steps will all fit. Well, this is what a verification, I'm going to hold it up here if I can. This is what a verification index looks like. Okay? What I basically did is I had my technicians go ahead and place temporary abutments. You can see the little metal rings there. Screw them into each implant. Then around each of those temporary abutments, we go at temporary cylinders, we put resin, acrylic, plastic. And they're all individual, so you can see the slices in between. What we then do in the mouth is we take these, screw them in, take x-rays to make sure they're fully seated, so we know it's each of these pieces is screwed to the top of the implant accurately. And then we go ahead with acrylic in the office. We use GC pattern resin because it's very strong and tends to be I believe it's a little more accurate. And we join these together. I tend to join them together in sections first, screw the sections back in, so I might do 2 or 3 at a time. Make sure they go back in, take an x-ray, and then go ahead and do the next bunch, till eventually we have the entire arch all joined together. So this becomes one piece. I know it now fits the mouth. All right, I don't screw it back on the model until I'm done. So this is all done in the mouth. Take each section off, put it in the mouth, put the next section, put it in the mouth, join that together with GC pattern resin. Then go ahead, take the third one, put that in the mouth, join it to the 2 in front. So eventually you're joining all these sections together in the mouth, not on the model, because we don't know if the model is accurate. So this is all done in the mouth. Then, once you have it all connected in the mouth, and there's radiographic proof to your satisfaction that all of these pieces fit on the implants accurately, then you can go ahead, try it back on the model, and it should fit perfectly. If it doesn't, then you will know that your model is not accurate. So you have 2 choices. You can either re-impression the entire mouth. If it's one that is not accurate, very often the technicians can cut that out, screw that implant analog into the index and just re-pour stone around it to reconfigure the model. Hope that made sense. If one of these, when you try this back on the model and you see it's not fitting to, say, one implant, well, the technicians can cut that implant section out of the model, screw it back into the index, and then flow plaster or stone or whatever around that one piece to reconfigure the model to fit the index, because you know the index is perfect. And that's the whole purpose behind a verification index, is to make sure that the model is accurate. Once you know that this model is accurate, then you can go ahead and design whatever your restoration is going to be, almost with impunity, because you know that it's going to fit. So as long as then it fits the model, you know it's going to fit the mouth. And that's the verification index. So you can see, I'll put a little clearer picture up here. And we haven't tried this in, obviously. This just came in, so I had a couple minutes. I thought I'd put this up. But it's very important that this model be accurate. With a single implant, different story, because then no, the problem doesn't exist. But once you have multiple implants, it's very important that you create a verification index, at least in my opinion, and make sure it all fits. Hope this makes sense. This is mainly for dentists, not for patients. My name is Dr. Cary Gans. I'm here in Garden City, New York, right across from Roosevelt Field, the new Neiman Marcus. And you can always, if you have any questions, you can always reach me at 516-741-1230. Once again, Dr. Cary Gans. If you're a dentist and have a question or a patient, or you're looking for a new dentist in the Garden City area, give me a call, 516-741-1230. And please, if you call, mention this video, whether you're a dentist or a patient. That way I know at least somebody listens to these silly things as they do. Have a great, successful day, and keep smiling.